forgot to do the lab diagnostics part, so I'm going to add this second link into Blackboard. This is the 21-year-old patient who complains of heavy bleeding and spotting throughout the month. She feels tired. She denies any other medical problems and doesn't take any medications. Her oxygen saturation is 96%. It's a little low, but not really a cause for concern. Her temperature is 98.4, that's good. Heart rate is 118. It's pretty high. She could just be nervous because she's in the hospital, but still 118 just from, anxiety is pretty high. Her blood pressure is 96/50. That is something that we would want to keep an eye on. That's a little bit low for a patient her age. Could be hypotensive, which is indicative of a low blood volume. Her white blood cell count is 8,000. Normal is 5 to 10,000, so she's good on that. Her red blood cell count is low. Normal is between 4.2 and 5.4 million, and she is at 3.4 million. Her hemoglobin is also low. Normal is between 12 and 16 for females, and she's at 10 grams per deciliter. Her hematocrit is also low. Normal for females is 37 to 47%, and she's at 30%. It's pretty low. Her glucose is 85 milligrams per deciliter. This is not really abnormally low or even low at all. This is a good reading for glucose, but we still want to do that hemoglobin A1C because this is going to tell us what her glucose has been over the past 2 to 3 months, and we want to know if it's been fluctuating at all because this reading right here may indicate that everything is fine, but we may find different results when we go back and look at her 3-month past history of glucose. Coagulation studies are very appropriate to order at this time. Because her red blood cell count is low, because her hemoglobin is low, because her hematocrit is low, this is going to be affecting potentially her ability to clot. We would want to know how her platelet count is. That's pretty important, and since she's been bleeding so much, I would assume that that's pretty low. A PET scan was ordered that is appropriate at this time. This is going to reveal if she has any diseases in her uterus or ovaries. We're gonna see how her blood is flowing, how her body is using the oxygen, how her body is using the sugar, and because she has low red blood cell production, low hemoglobin, low hematocrit, that could be indicative of a liver disease, and that's why production is low. Also from the bleeding, that's another very common thing. You're bleeding a lot, obviously your numbers are going to be low. Also, another reason for the hemoglobin A1C, a byproduct of hypoglycemia, is poor liver functioning, so that could also be affecting why her red blood cell count is so low.